I was recently sent a long message raising concerns, serious concerns about ECT, electroconvulsive therapy, electric shock therapy is what I call it. I underwent this. The person who reached out has a medical background, and they spent years researching lawsuits, consent, issues, neurological injuries tied to ECT. Their core point to me was this, that ECT is often presented as safe and routine, that consent frequently excludes discussion of acquired brain injury, that patients may experience memory loss, personality change, emotional blunting, and lack of awareness of damage. That these outcomes are then mislabeled as psychiatric symptoms instead of neurological trauma, and that patients are rarely treated as brain injury patients afterwards, basically. They argue this creates a cycle where harm is missed, right? Minimized, basically financially protected rather than addressed. This is my response. I can only speak from my lived experience. I underwent ECT during a very severe period after leaving the military. At the time, consent focused on symptom relief. I was not given a clear explanation. Potential long-term neurological consequences weren't given to me. It was supposed to help me out of this deep depression I was in. I experienced memory loss, emotional flattening, and a phase where I believed I was better, when in reality I was disconnected. It took years to understand what I lost and what I had to rebuild, which I'm doing now. Here's the nuance, here's what really matters. Some people feel ECT saved their life in a short term. I won't deny that, but others carry lasting consequences that were never properly explained. That gap in informed consent is real. What I firmly agree with this is patients deserve full transparent consent. Patients deserve to understand neurological risk, not just psychiatric framing. Patients who struggle after ECT should be evaluated as trauma and brain injury cases, not dismissed silence that protects systems, not people. This isn't about fear, it's about honesty. It's about treating people as adults capable of informed choice. I'm not here to attack, I'm here to speak truthfully, without minimizing harm or pretending it doesn't exist. I'm tagging the person who sent the original message so their perspective is visible. Conversations like this are uncomfortable, I know, but they're necessary. Love you all. Strive with OCs.